Mental illness costs the Canadian economy billions of dollars in lost productivity each year, and yet only 1 in 3 Canadians who experience a mental health illness report seeking treatment. It's clearly an issue that workplaces can no longer afford to ignore.
Carolyn Dewa is the head of the Centre for Research on Employment and Workplace Health at the Centre for Addiction and Mental Health. Dr. Katy Kamkar is a clinical psychologist who works at the Work, Stress and Health program at CAMH. So good to have you both here.
Thank you for having us.
Tell us why you think employers should be concerned about mental illness. Why don't we start with you?
We know that aside from home, the workplace is the primary location of the adult life. And so it plays a significant role in our health and in our well-being. We also know that we all have a common human needs, which are a sense of belonging, sense of self-worth, and a sense of security, and we all need this kind of accomplishment. And so because workplace is such a significant component of our daily life, we need the workplace to promote and to maintain those important needs.
And I think, and I'll ask you this, Carolyn, I mean, when you talk about a workplace, there's going to be a level of stress in any workplace. There's going to be, you know, a level maybe of anxiety depending on the project you're on. But at what point, you know, in terms of the workplace, the employer, do you recognize that that's not a normal level of stress? I mean, how does that differentiate?
So I think there's stress when we're trying to meet a deadline, which is healthy stress because it helps us get to that deadline. The problem happens when every day is trying to meet a deadline and it's a chronic high stress situation. And I think the people who are most exposed to the high stress are the people who we count on at work. So they're the people who believe in their workplaces and who want to see it succeed, who will stay the extra hours, who will change their work hours. So as employers, it's important to protect the health of those people because they're our go-to people. They're the people we count on.
And how do you do that? How do they go about that, making, you know, in terms of the conversation in the workplace?
Part of it is, why do we only have one go-to person? Why isn't it the team? So to develop a team so that people can trade off, so it's not always one person. To ask people, how are you doing? And to build that social network. I think Donna was talking about how the social support was important at work, yet we've removed the things that make for that social support. Like, how often do you eat lunch with colleagues? It's usually at your desk. There's usually no lunchroom in a workplace because we're saving space. How often do you just talk to somebody and ask how they're doing? So we're always in a rush, and that rush helps prevent that social support building.
We're hearing that 1 in 5 Canadians is mentally ill. And so in the workplace, Dr. Kamkar, where can one seek help when they need it?
There are various ways to seek help, and I think that, you know, as Dr. Dewa indicated, mental health again at work is very important because stress at work, especially chronic stress, does lead to reduced productivity, increased relationship conflict at work, and then also, of course, increased anxiety and depression. It's very important to seek support. I mean, as often organizations, they might have various resources available. It could be employee assistance program, it could be stress or anger management program, and so on. People can also go to CAMH.ca. There's also as well the connectsontario.ca. They can also see their GP for various referrals. Effective treatments are available, and I think that today what we are doing, just talking about mental health illness, it's an amazing thing, an amazing initiative to, again, raising awareness of mental health and to really encourage those who are in need to seek help. So really at this point, providing support and providing acceptance are really essential.
It would also seem that it would be, I guess, essential to the point as well that you are making, that people who you work with are aware of it too, not just for themselves, but for someone else out there. I mean, what are the kinds of things, if you're seeing and you're noticing somebody who's stressed, what are the kinds of triggers or flags that there might be?
So it doesn't happen overnight, and you see a change in behavior. And if it's a prolonged change in behavior, like someone who usually talks to other people becomes withdrawn, or somebody looks exhausted all the time, or someone's not able to focus or concentrate, and that's sometimes the hardest conversations to have, to say, you know, I see that you may be struggling. Even as a manager, when it's your position to do that, everybody's afraid that I have to treat. No, we don't want you to treat or diagnose, but to be a manager, how do I help you be the best you can be at work? Are you struggling? Are there things that we can help with?
And it's an interesting point you make, because when it comes to mental illness, it's not something that we see per se. So it's not, you know, as if someone has a broken arm or a broken leg. And so it's hard, I think, for people to approach that. We live in a society which is very much mind your own business, take care of oneself. But with regards to this, you kind of have to go outside the comfort zone, correct?
Definitely. Something that, as you mentioned, we do not see, and that is why people can really suffer in silence. There are certain things that maybe indirectly we might see. So it could be reduced productivity, they might self-isolate, they might experience a lot of mood irritability, which then can increase the conflict at work. So there are certain changes, or again, increase in maybe sick leave or sick days or absenteeism. So there are certain various ways that we might be able, directly or indirectly, to observe. And as also Dr. Dua mentioned, there are really early warning signs of stress. So it's very important for people to be aware of, what are the early warning signs of stress, so that really people can seek help. Because again, when we talk about stress or in general mental health problems, these are things that can really affect us, like thinking, so cognitively, they can affect us physically, emotionally, and also behaviorally. We can also get in behavioral changes as well.
Doctors, thank you so much.
Thank
Good
you.
to have you.